Good morning. Glad to see all of your faces here today, and glad to be able to present some of this information because what I do, a lot of people don't know what a neuropsychological evaluation is or what it's for. So I enjoy explaining to patients a little bit more about what their care involves and what we're looking at. Let me make sure I know how to work this clicker. Okay, good. um, so I've been at Rush here for about 5 years almost, and I've been part of the Huntington's Clinic since the beginning. And if you have met myself or my colleague, Dr. Brian Bernard, who does the same thing, if you were new in our clinic, you might have had a neuropsych evaluation on your very first day. Sometimes we wait till later, but if not, that's okay. If you're interested in having one and you haven't had one, then please just talk to your provider. You can talk to me afterwards. So Huntington's disease symptoms fall into three major categories. Motor symptoms, which are the way that your muscles move, the way that your body moves. Cognitive symptoms, which include the way that you think, your memory, your reasoning, your attention skills. And psychiatric symptoms, which often involves your mood. So that's when we're talking about things like depression or anxiety. Sometimes when we're talking about a little bit more serious psychiatric issues like maybe paranoia, which is like an extreme version of anxiety, and delusions and things like that. So HD symptoms fall into these three categories, but the diagnosis is made when motor symptoms show up, when those start. But oftentimes the cognitive and psychiatric symptoms can impair functioning early on in the disease, maybe even before the motor symptoms are real obvious or become a problem in your day-to-day life. And the cognitive and psychiatric things can sometimes cause problems at work or at home. There might be subtle changes in the way a patient interacts with other people or how they're able to perform their job functions. So those can show up early on. So let's talk in a little bit more detail about what is cognition. So it involves a lot of different things, brain processes that are mental skills and activity. So in general, thinking, but if you break down what thinking is, it's perceiving information, right? Information comes from the world outside of you, and different parts of your body pick up that information, like your eyes pick up your eyes are involved in vision, your ears are involved in hearing, all kinds of things. And then once your brain picks up those signals, it's making sense out of those signals. What am I seeing? What am I hearing? And then making meaning out of it. Okay, what does it mean for me? All these pieces of information. Um, and the meaning making part is where the rest of it comes in too, the learning and memory. So whatever you're perceiving right now, how does it fit in with what you already know of the world or of yourself or other people? Language and communication, how do you talk about it? How do you express what you see or feel or hear? Language also works the other way, right? How do you understand what other people are saying, both verbally and non-verbally? Concept formation, if you think about the concepts of things, abstract thinking, solving problems and planning. So if you have to perform a task, you have to figure out what the problem is. What are the steps that need to be completed to do this task? Break it down, decide which one comes first. If there's a monkey wrench in the problem, in the situation, you have to figure out how to switch gears, and so there's a lot that goes into it. Um, so there's different kinds of cognitive changes that can happen in HD. Early on in the disease, the cognitive decline can manifest as memory and learning difficulties, problems with judgment and trouble with driving, answering questions or making decisions. And as the disease progresses, there may be more difficulties with concentration and focus, and things might become more difficult. So let's talk about memory first. So if you break down memory, what does memory mean? First, you have to learn something new, right? It has to get inside your brain, and then you have to hold on to it, the storage part. So you have to keep that new information in your brain over a period of time. Short-term memory, in as a neuropsychological term, usually means about a few seconds time. What did you just hear someone say a moment ago? Long-term memory is well, we use that term in our everyday speak to talk about long-term memory, like who was my third grade teacher or what street did I grow up on. But when a neuropsychologist uses the term long-term memory, we're talking about a few minutes, like 20 minutes to an hour, something like that. Um, so memory is learning something, getting it in, storing it, keeping it over a period of time, and pulling it out when you need it, right? That's the memory part. What were you supposed to do today? You have to pull that information out from what you learned yesterday. Yesterday, your mom told you to pick up some butter at the store, right? And then there's another part of memory that we don't think about as much, but it's called recognition, right? So were you supposed to get butter or milk? Recognizing which one of the two things. Um, Perception, we talked about that already in some detail, but when we talk about everyday living, perception involves your depth perception, right? Can you perceive how far down you have to step in order to go down the stairs? Can you see where the curb ends and where the street begins? Can you see, or can you have a sense of where the end of your car is, so you know how far to pull up before you're going to hit that pole in front of you? Visual identification, being able to see something and know what it is. Is that a hammock or is that a net, right? They have very similar properties, and being able to understand what the purpose of those things are. Um, Executive functioning is a very fancy term that involves a lot of different things, but it involves sort of the complex parts of thinking, where you have to make plans and anticipate consequences. If you think about what's involved when you anticipate a consequence, when you think, okay, I'm going to go do this thing, what are the possible situations that could arise? It's based on your entire wealth of knowledge as a human person, having done similar things in the past, to be able to estimate the likelihood. Okay, if I go to this party, I know this guy's going to be there, and what's the likelihood that I'm going to run into it? Has to do with how many people might be there, what kind of a party is. All those pieces of information get consolidated into your brain in order to make a decision. Am I going to go? Am I going to not go? um, Multitasking, right? Stirring the pot, talking on the phone at the same time, and also kind of keeping a running list of what you might need when you go to Home Depot later today, all those things. Language and communication, we talked about that before, the difference between receptive and expressive language. But one of the problems that often shows up fairly early on in Huntington's disease and other neurodegenerative disorders is word finding issues. So you know what you want to say, you know what you're trying to express, but that one word, you're looking for it. What is the word I'm looking for? Oh, sympathize, right? Or it might take you a few hours before you can think of the word that you wanted to use. And sometimes that will like derail a conversation, right? If you get so stuck on trying to find that one word that you wanted to use, like, oh, spatula, that's what I was trying to say. You can kind of lose your focus in your conversation. So it seems like a simple thing, but it can really have a big impact on your communication. Um, so we kind of went over this already for memory and learning. It's the ability to acquire new information or modify your existing knowledge. So let's say you always thought Huntington's disease involved something, but you learned a new piece of information. So you have to kind of adjust what your thinking is about a particular concept based on this new information. And it will affect your behaviors and your values and your preferences. So here's an example of learning. So remember, somebody says, do you remember you're going to be meeting with John on Thursday, right? So the recall or the retrieval part, let's say the next day, somebody asks you, who are you meeting with? And you have to pull out that information. It's kind of like sorting through your file system in your brain to figure out where that information is. When is that meeting supposed to be? Sometimes that can be difficult. Early on, there would be changes in the recall part of it, but sometimes recognition is preserved for longer. So that way, cues can help. Are you supposed to be meeting with Chris or Pat? Oh, okay, that's right. I remember it was with Pat. Was the meeting on Thursday or Friday? That's right, it was on Thursday. And I remember that because I also have to go to my dermatologist appointment on Thursday. So there's different types of memory. Explicit versus implicit memory. So explicit memory is the stuff that you can like say out loud to another person. My name is Charlotte. I was born on July the 19th. That's a date. A fact about me is that I grew up in Huntsville, Alabama. I can just say that out loud. Implicit memory is a little bit different. That's often preserved longer when there are cognitive difficulties. So those are skill type memories. So learning how to tie your shoelaces, it's a little bit more difficult to verbalize. You don't say to tie your shoelaces, you do this. You'd have to explain it in a very long way, right? Or muscle memory. Some people call it that. Muscle memory isn't really memory within your muscles, but it has to do with procedures that you remember how to do and you kind of do automatically, like driving, right? If you remember when you learned how to drive, somebody explained it to you pretty explicitly. Put your foot on the brake, and then take the gear shift and put it into drive, all of that. But after you learn those basics, you just kind of do it without thinking. That's also memory too. It's just a little more implicit. So this all involves combining lots of pieces of information. So perceptual skills, I talked briefly earlier about some of the basics in terms of perceiving like visual differences. Where does the curb end? Where does the street start? But it also has to do with more subtle things like your sense of time, right? We all have a sense of how much time has passed, even if you don't look at your watch or your phone, you can kind of tell it's been about 5 minutes or it's been about an hour or so. Sometimes that can be impaired. So people will sometimes say, I've lost my sense of time. Like I can't tell whether something happened yesterday or did it happen 3 weeks ago. Or other people will notice that in their patient who has Huntington's disease. That may also contribute to why somebody is always running late. So think about the early disease process and how that might affect your work if you're constantly arriving at work late and you really don't know why because your routine in the morning hasn't changed. Nothing else is different. It might be that sense of time that used to be what told you, okay, you need to hurry up now. This is taking too long. You're going to be late is kind of impaired. Also, sense of personal space, that might also be one that changes. So different cultures have different sort of social norms about what the appropriate amount of space to have between you and a person you're talking to. And of course, that changes depending on your relationship with them, right? Like you wouldn't necessarily walk right up to your boss and put your arm around their shoulder. I mean, you might if you worked with them for a very long time, but you have different sense of what's comfortable and what's uncomfortable, right? I think there was a Saturday Night Live special about the close talker a long time ago. So somebody who's like right up in your face. And so sometimes that part can be kind of impaired. The awareness of social norms, like picking up on other people's bodily postures that tells you this person's uncomfortable. I might need to back up a little bit. So some of those things might be impaired too. And also the ability to judge the distance between your own body and where something else is, like the corner of a coffee table. So that might lead to bumping into things in your own house. You don't necessarily, like an environment where you're real familiar with it, you don't necessarily need to see the corner of the coffee table to know that it's there and kind of go around it so you don't bump into it because you have that sense already. Sometimes that can be impaired as well. Um, Smell identification, I think that was left over from a different slide from before. That's often more an issue with Parkinson's disease than it is with Huntington's. But in terms of emotion recognition, this may also be an issue. So being able to perceive other people's facial expressions, there is such a thing that's called a micro expression, which is a very quick shift in somebody's facial expression that lasts like a split second and often kind of sets the tone for whatever interaction you're about to have. If you've ever had an argument with a loved one, you have experienced this before where you saw something on their face and something's going to happen, even though there's no actual obvious, reason why you're about to get into a fight, but that's going to happen, right? A lot of that is based on micro expression, facial expressions. So that you can understand how that might have an impact on your social relationships if you're having a difficulty picking up on some of those social cues. Okay, so back to executive functioning. So these are functions that are um, for the most part, managed by the frontal lobes. Those are the lobes of your brain that are most developed in terms of evolution. They're in the front part of your brain, which is why they're called the frontal lobes. And they manage a lot of different things. So processing speed. So how quickly you can take in new information, decide what to do about it, and then execute some sort of behavior. How quickly that happens. So sometimes in Huntington's disease, that can be either slower, processing speed can become slower, or it's early on in the process. It may not be slower, but it takes more effort. You get more worn out just to do the same thing, just to balance your checkbook. You notice that it becomes more of a pain in the butt than it used to be for no particular reason at all. So some people will say, "Oh, my math skills are down. I can't do math anymore." May not necessarily be math per se, because you still know what 7 + 3 is, but it might take more effort to do multiple calculations over and over, like you do if you balance your checkbook. If anybody does that anymore, I just use online banking and go by it, but because it's a pain in the butt. But in terms of attention, so a lot of people think about attention as like really kind of focusing in on one thing and listening and paying attention. But there's many pieces of attention that we do all the time, shifting your attention back and forth. So as I'm talking to you and leaning on the lectern, I noticed that my ID badge was poking into my stomach. So I quickly adjusted it and I'm now back to talking to you. So being able to shift your attention from one thing to another or pay attention to two things at a time. I'm a new mom, so I certainly have learned to pay attention to, the timer over here and the kid over here, and my husband talking to me in the back over here, and trying to, keep track of a million things at once. So those are all very complicated processes that sometimes can break down. So I'm going to speak about recommendations here in a minute too. Um, uh, so organization, so sorting through different pieces of information and deciding this is important, this I don't really need to worry about. Your brain does that unconsciously all day long. There's no way to actually keep and retain every single piece of information that you perceive. Your brain naturally just sort of gets rid of the irrelevant stuff. Sometimes when there are difficulties with executive functioning, the brain might get rid of important stuff accidentally. So what may look like a problem with memory may actually be a problem with organization of information, that it's not as efficient. Strategizing and prioritizing. I have exactly 3 hours and 5 errands to run. Which ones am I going to do? Obviously, I'm going to do the ones that are all kind of grouped together, or I'm going to do the one errand that's way far away, but it's the most important one, strategizing and prioritizing. So those are all things that your frontal lobes help you do. Troubleshooting, what went wrong? What do I need to do about it? Do I need to address it right now? Do I need to leave it for a little bit and come back to it? So those kinds of things. We talked about language and communication. So that means both getting information in, so being able to understand what other people say, what you read, what you hear, those are all receptive language functions. Being able to process it and understand it. Sometimes I hear a lot of patients talking about, I don't have a problem understanding, but when there's a lot of information coming to me at once or very fast, then I just kind of zone out and I don't hear any of it. So that could be an issue with language, or it could be an issue with attention, or it could be an issue with anxiety. We'll talk about that a little bit in a minute. Getting information out. So we talked about word finding difficulty, but sometimes there's also breakdowns in syntax, meaning that the words are correct. You get your meaning across, but the way that the words are arranged in the sentence isn't the normal way that we do it in the English language. So there might be word reversals where you might say a word before the other one, and you can still kind of get your meaning across, but it becomes jumbled. So if you think about if you are still working and you're sending an email and your words come across incorrectly and it's there in print for somebody to see, then it might be picked up on in terms of your job performance. So communication is basically the transfer of information from one person to the other. And it's a complex process that integrates not only your thoughts, but also your muscle control. So that's where the motor part does also affect communication. It means literally the muscles of your mouth, your tongue, and your diaphragm to control your breath in order to produce the words. So you can notice I'm a little bit breathless. I usually am because I'm nervous. I'm not great at giving presentations, but you have to have good, excellent breath control in order to say that what you want to say. And so oftentimes in patients with Huntington's disease, if there's a motor problem with the diaphragm, it does affect their ability to communicate because they might run out of air or need to breathe a little bit more quickly, which makes talking more effortful. So there's a lot that can be going on. So let's get to the recommendations part. So if you or your loved one are having difficulties with memory, there's some things that you can do to try to work around it. One is if you're communicating with somebody who has memory issues, try to use simple and short statements. That's best for new information. You might even pause after you give a piece of information. Okay, when you go over to grandma's house today, Vicky's going to be there. Pause. When you see Vicky, don't forget to ask her for X, Y, and Z. You can use notes. Obviously, you can keep a notebook on you at times. If you are savvy with your phone, you could use a voice recording if you like that. And repetition and practice are very old school, but very good ways to try to remember something new. You say it to yourself over and over again. Don't forget to pick up butter. Don't forget to pick up butter. And you can say it out loud. It doesn't mean you have to say it loudly, but say it out loud. Actually make the words with your mouth. Just the act of doing that will help it stick in your memory a little bit better. If you find that there are certain things that are constantly being forgotten, like locking the door, you can put a sticky note right there. Lock the door. You might want to change it up after a while because if we see the same thing over and over again, it becomes part of like the background. You don't notice it anymore. So you want to change up the color of the sticky note or the kind of marker that you use every once in a while. In case you've ever had the experience of something being there and you don't see it just because it's been there for so long, you're completely blind to it. Yeah, you could also, when you say things out loud and you're trying to commit them to memory, try and associate it with something else. So incorporate it into information that you already have. So you're going to say it out loud. I have an appointment with John on Thursday. It's on Thursday because I'll already be at Rush for my dermatology appointment and we can go and meet John right afterwards. So just the act of trying to incorporate that new piece of information with the old is one good way to be able to remember some things. In terms of executive functioning, asking open-ended versus closed-ended questions can often get you different kinds of information. What happened yesterday? When really what you want to know is, did you see John yesterday? Just ask, did you see John yesterday? You're probably going to get a better answer with somebody who's having difficulty with executive functioning. Avoiding multitasking, concentrating on one thing at a time, removing distractions when necessary. So turning off the television, quieting the dog down. Okay, now remember this. I'm going to tell you this. Or if you have to concentrate on doing a task, trying to remove those distractions. Keeping a checklist is often a great way to be able to keep track of the steps that you've completed and where you left off if you have to stop in the middle. Allowing extra time for your responses, giving somebody verbal cues, getting them started. Obviously, you want to give somebody who has difficulty with communication a couple extra seconds to say it if they can, but they're clearly having trouble. You can say, you know, are you trying to tell me about what happened yesterday? To kind of get them started can be helpful. These are things that you have to kind of negotiate with your conversation partner to not overstep your bounds and put words into other people's mouths. And ask for clarification. If you understand what somebody with HD is saying, ask them to repeat it. Don't pretend that you do understand because you might get an important detail wrong, and that would not be good. So I'm going to skip over a couple of slides because I'm running out of time. But how do we determine if there are cognitive deficits? That's when you have a neuropsychological evaluation, which involves an interview, some paper and pencil tests, and then oftentimes I can provide feedback and recommendations the next time you come in for your clinic visit, or if we need to do it over the phone, we can do that. It usually takes about 1.5 to 2 hours in our clinic. There are different kinds of neuropsych evaluations. Some of them take a really long time. We don't have to do that, all of that all the time. And it should be done by a neuropsychologist. And it happens in our clinic all the time. So if you wanted to schedule one, you are welcome to do so. That is all I have to say. Questions? Thank you. Okay, I'll be available.